Greetings. I'm Anika Bell, and I'm a Director of Medical Science Liaison with ViiV Healthcare. On behalf of my colleagues, I'd like to present this data on disparities in HIV. Awareness leads to action. According to the CDC, at year-end 2019, an estimated 1.2 million people in the United States aged 13 years and older had HIV. While tremendous strides have been made and we still have a long way to go in the treatment and prevention of HIV, about 13% of people with HIV in the United States don't know they have it. Of those with a diagnosis, about 65.9% received some HIV care, and about half of those were retained in care, while about 56.8% were virally suppressed or undetectable. Discovering this data in the HIV continuum is also uncovering key disparities in treatment and prevention in certain populations, particularly people of color, women, and those living in the US South. This begs the question, what are we doing to target the populations that are at greatest risk? So let's look how individuals are contracting HIV. It's not a surprise that in males, male to male sexual contact is the leading route of transmission, while in those born female at birth, heterosexual contact is the leading cause. The surprising statistic here is injection drug use. Clearly, there's a disparity in the number of diagnoses attributed to IV drug use in women versus 16% in versus men at 5%. If we dig even deeper into the statistic, we see that this number is driven by the increased number of white women injecting drugs and transmitting HIV through infected needles. This is a part of a growing disparity in this space around women, the cross relationships of how policies, social stigmatization, and other factors influence the risk of women vulnerable to HIV. So ask yourself, knowing this, how can we be proactive in this space? How often do we see women who use drugs in prevention research? Now let's look at the risk of contracting HIV in a lifetime by race. We clearly see the disparity here with Black and African American men and women being six-fold and 12-fold more likely to be diagnosed with HIV in their lifetime than white men and women, respectively. If we look at this diagnosis rate in Black and African American women in 2020, we see that even though Black women only make up 13% of the US population, they account for 54% of all new diagnoses among women. So where's the disparity? If we look at prevention, we know that preventative therapy for HIV has been around since 2012, and yet we continue to see the numbers of Black women at risk increase. So let's take a look at the PrEP data and how this may play. Okay, focus your attention to the graph on the left. We see those that have an indication for PrEP with Black or African American individuals at 39%, Hispanic or Latinx ethnicity at 26%, and those that are white at 25%. But when we look at the graph on the right, and these are people who are actually prescribed PrEP, we see that those who are white are overwhelmingly offered or prescribed PrEP at an alarmingly higher rate than non-white individuals. So what are the reasons? Are these provider-based reasons? Are they biases? Are they patient acceptances? Are they insurance reasons? This makes it important to think about how we're engaging those that could benefit from PrEP into care. Research shows that people with HIV who get and keep an undetectable viral load can live long and healthy lives and will not transmit HIV to their HIV negative counterparts through sex. This is called undetectable equals untransmittable. Higher replicating virus increases the chance that HIV will be transmitted, can cause increase in inflammation, leading to comorbidities and potential drug resistance. We see when we look at the graph to the left, according to the CDC, Black and Hispanics had a higher mean number of days with a high viral load than whites. To add to this, also, Hispanics and Black population had a longer time to diagnosis from transmission, and significantly less Black individuals were virologically suppressed versus other counterparts. All of these factors, when we look at it, lead to the fact that Blacks and Hispanics living with HIV with the viral load may in turn impact transmission rates negatively in these communities, as well as impact the health of these individuals living with HIV. So knowing these data, what can we do to move to action to ensure we're linking those most at risk to care and on top of that, engaging them. These data presented here today are just some of the disparities that appear in HIV care. To add to these, although they are disproportionately affected by HIV in the United States, Black women are severely represented in HIV clinical trials relative to their white counterparts. The good news is the FDA has now issued a new draft guidance to industry for developing plans to enroll more participants from underrepresented racial and ethnic populations in the